Hello everyone, this is Dr. Christina from the TMJ and Sleep Therapy Center of Cleveland. I was recently invited onto a podcast where I was giving an interview about sleep and sleep disorders, namely the sleep disorders that we treat here at our TMJ and Sleep Therapy Center are those that belong to the class of sleep disorders called sleep-related breathing disorders. And what does that mean? It's essentially encompassing these sleep disorders that have an issue with upper airway or the collapsible part here in your throat. So if you've ever seen an apneic or had an idea of what somebody with sleep apnea is, you know, they get that sort of suffocation-y, snorty sound when they're sleeping. So if you're, sleeping, and then, your tongue falls back into your throat, it blocks off the airway, so you're not getting any air coming through, so you're essentially suffocating. It is a very serious disorder and something that we obviously take very seriously and treat very seriously in our practice. And part of our goal as well is to raise a lot of awareness about these sleep breathing disorders because unfortunately, they're not being treated appropriately or they're not being treated at all. They are known to be very undertreated, and when they are treated, a lot of times the treatments aren't working, so people sort of give up on the treatments. And so one of our big goals here at the TMJ and Sleep Therapy Center is to not only help people to identify if they have a sleep breathing disorder, but also making sure that they are finding a treatment that works for them. Because while CPAP is considered the gold standard of treatment for a lot of these sleep breathing disorders, it is not very well tolerated by a lot of people. And so we just want to make sure that if they cannot tolerate CPAP, that some form of treatment is happening and that they are actually getting treated for whatever disorder that they may have. And so where we come in as dentists with that is oral appliance therapy. And what that is, it's, imagine like a mouth guard that you've had previously, except it's a little bit more complicated than just that, a mouth guard that you've probably been given by your dentist, and that it has to help hold the airway open. So there is a specific way in which we have to take the bite and in which the appliances themselves are made. But that is something that we can offer our patients and people who have these sleep breathing disorders. The one other thing that I'm going to bring up just in this short video, and then we will sort of dive deeper into everything as we continue on a lot of these video series, is that not all sleep breathing disorders are sleep apnea. There is this common misconception that sleep apnea only occurs to obese men, right, or obese women, and anatomically that's the only thing that plays a role in if somebody does have sleep apnea or they're more susceptible to getting it, and that's really not true. Women, children, men of all shapes and sizes suffer from sleep breathing disorders. And again, it's something that we're going to be able to dive deeper into on each individual video. We don't want to bog it down too much here just on one single video. But another sleep disorder that you will hear us talk about quite a bit is called upper airway resistance syndrome, UARS. And you may hear me refer to it as young fit female syndrome, and that's because that is the population that it seems to affect the most. Females more than males, younger more than older, and then thinner. They don't have a high BMI, this kind of subset of patients that suffer from this specific sleep apnea here. So it can happen to everybody. And if you tend to wake up and you feel unrefreshed when you wake up in the morning, you never feel like you got enough sleep, you're always restless, you're tired, you're fatigued, not just tired and sleepy, but generally fatigued, then we have a lot of great information that we're going to be able to share with you, a lot of great things that we can help do to treat you as well. So stay tuned for everything that we have for you. We'll dive deeper into all of these issues and how we can help optimize your sleep, get you out of pain, and get you living your best life.